I'm going to go ask people to give me the first thing that comes to their mind when they hear the word cancer.
Pain.
Infection.
Disease.
Tumor.
Exhausting.
Scary.
Uncertainty.
Illness.
Sadness.
Patient.
Fight.
Journey.
Research.
Chronic.
Battle.
Tough. Death.
Survivor.
Serena's interview highlights how complex and impactful cancer is, not only biologically, but also emotionally and socially. To better understand how something like resistance exercise could play a role in this process, we need to first understand what cancer actually is. Cancer is a group of diseases characterized by uncontrolled cell growth and division. Normally, our cells will follow strict regulatory signals that control when they should grow or when they should die. However, with cancer cells, these systems can break down. Mutations in DNA can cause cells to ignore signals that would normally stop growth or trigger cell death. As a result, these abnormal cells can accumulate and form tumors. In some cases, these can spread around the body through a process called metastasis. Now, why is cancer such an issue? Well, cancer is a major issue, being one of the leading causes of death in Canada. Not only that, after heart disease, it is one of the top killers worldwide. Cancer can arise from many different causes. Genetic factors and environmental factors all can contribute to its development. As a result, it is particularly difficult to prevent and treat. Statistics from the Canadian Cancer Society have predicted that in 2025, 254,800 Canadians were expected to be diagnosed in 2025, with 87,400 expected to die from cancer. Furthermore, 42% of people in Canada are expected to be diagnosed with cancer. This is almost 1 in 2 people who will be diagnosed with cancer. Cancer treatment also places astronomical costs on the healthcare system, being projected to be around $37.7 billion in 2024. In addition, a diagnosis can be an immense burden on the cancer patients and their caregivers, who face a projected $33,000 of associated costs with transportation and lost wages, all contributing to this number. This is why developing effective treatments and therapeutics to combat cancer is so important, and why complementary strategies like resistance exercise are researched. Researchers are increasingly interested in how lifestyle interventions like prescribed exercise can help prevent cancer or support recovery.
I'm going to ask people to give me the first thing that comes to their mind when they hear the word resistance exercise.
Gym.
Working out.
Strength.
Muscle.
Discipline.
Growth.
Resilience.
Healthy.
Power.
Athlete.
Longevity.
Balance.
Train.
Endurance.
Consistency. Muscle.
Quality of life.
With insights into what resistance exercise is seen as among people who might not be as associated with exercise as us kin students would be, we should first elucidate what we would call resistance exercise. Now, this is not a novel topic, and much has been invested into research concerning something as accessible as resistance exercise and how it might impact cancer. For the sake of this presentation, we can define resistance exercise as a form of physical activity where muscles contract against an external force. This could be weightlifting, but it can also be something as simple as gentle squats with the support of a chair. The big benefit of resistance exercise is how accessible it is and its ability to be scaled to the abilities of the individual. Anybody who is mobile can perform some form of resistance exercise. This positions it as a promising therapeutic approach, with a growing body of research that identifies its potential roles in preventing the development of cancers, suggests a role in helping assist in the treatment of cancers, as well as potentially acting in support of recovery following cancer. Going more in depth into the aspects of this treatment, we will focus on a number of studies that highlight these promising features of resistance exercise.
To show some evidence, here's journal article number 1. Resistance exercise training increases muscle mass and strength in prostate cancer patients on androgen deprivation therapy by Hubin and colleagues. This study looked at men with prostate cancer who are receiving androgen deprivation therapy, or ADT. ADT is a treatment that lowers androgen levels like testosterone to help slow the growth of prostate cancer. But even though it helps treat the cancer, it can also cause some really difficult side effects like the loss of muscle, increased body fat, and an overall decline in physical health. Because of that, researchers wanted to see whether resistance exercise could help support these patients during treatment. They used a 20-week supervised whole-body resistance training program done twice a week for about 60 minutes. The workouts included exercises like the leg press, leg extension, chest press, lateral pull-down, shoulder press, and horizontal row, along with a short warm-up and cool-down on a cycle ergometer. The findings were really positive. The men who did the resistance training increased their muscle mass and strength, while the control group declined over time. The added protein supplementation did not create extra benefits, showing that the exercise itself was the main reason for the improvement. What makes this article so meaningful is that it shows resistance exercise can help manage the side effects of cancer treatment more broadly. It's not just about fitness, it's about helping patients feel stronger, maintain their bodies, and protect their quality of life while going through something physically demanding. So overall, this study suggests that resistance training should be seen as an important part of supportive cancer care.
This is about a peer-reviewed study on progressive resistant exercise training for lung cancer survivors. The main question was whether this kind of supervised strength training could be safe and helpful after treatment. This matters because many lung cancer survivors have low physical function after treatment, which can make daily activities harder. The goal was to see if resistant exercise could help improve strength and function. The study included 17 post-treatment lung cancer survivors in the progressive resistance training program. The researchers measured strength, endurance, walking ability, and other simple function tests. The results were positive. Participants improved in strength, endurance, and physical function, including walking distance and movement tests. Adherence was very high, so the program also seemed realistic and manageable. Overall, this study suggests that resistant exercise can help lung cancer survivors recover strength and function after treatment.
So here's something that might change how you think about going to the gym. What if lifting weights could actually help reduce your risk of dying from cancer? There's a study published in the British Journal of Sports Medicine that looked into this, and the results are pretty interesting. This wasn't just a small experiment, it was a systematic review and meta-analysis, meaning the researchers combined data from multiple large studies to get a more reliable answer. In total, they analyzed data from over 500,000 participants, followed over long periods of time. So this is a large-scale, long-term evidence. What they focused on specifically was muscle strengthening activities like weightlifting, resistance training, or bodyweight exercises. They compared people who regularly did these types of workouts to people who didn't do any at all. Then they tracked long-term health outcomes, including cancer mortality. And here's what they found. People who did regular resistance training had about a 10 to 17% lower risk of dying from cancer compared to those who didn't. And what's really interesting is that you don't need to spend hours in the gym. The biggest benefits were seen with just 30 to 60 minutes of resistance training per week. So just a few workouts can actually make a measurable difference. Now, this study shows a strong association, not a direct cause, but the pattern is consistent across a very large scale of people. And there's a biological reason behind it. Resistance training helps build muscle, which improves metabolism, reduces inflammation, supports your immune system, and helps regulate hormones like insulin. And all of these play a role in how your body detects and fights cancer cells. So why does this study matter? Because it shows that resistance training isn't just about getting stronger or looking better. It's actually a powerful tool for long-term health and disease prevention. And when something as simple as lifting weights a few times a week can lower your risk like that, that's something worth paying attention to.
Finally, we will talk about some limitations and barriers to using resistance exercise for cancer therapy. From a study done in 2022, they found there were 243 different barriers and limitations. Some examples of these limitations are patients not being physically fit to exercise, whether it is due to a disability, an injury, or if it is from the effects of cancer treatment. Healthcare providers feel uncertain about exercise safety for the patient and may be hesitant to recommend exercise to older or inactive patients. Exercise is sometimes viewed as optional, and providers believe it is not useful in cancer therapy. Programs are not individualized to specific patients. This is important, as mentioned earlier. Resistance exercise has a larger impact on certain types of cancer. These same programs may not be reimbursed by insurance and can be expensive. And finally, patients may be uninformed about available programs, as well as they may not know that they can exercise during treatment.
Why did you think to do resistance exercise throughout your experience with cancer?
Well, when you're diagnosed with cancer, in this case it was a rare cancer, it's called chondrosarcoma, soft tissue of the bone, you go through an emotional roller coaster. There is an immediate uncertainty, what's going to happen. You ask yourself, what is it going to mean? I have cancer. How do you react? How are you supposed to react? What's next? While attending doctor's visits, continuous doctor visits at the hospital, you start doing some research, and you got to be mentally strong. You find out that the usual sleep, good diet, and one of the most important things I learned was exercise, especially resistance. Many people told me the stronger you are going into it, the stronger you are coming out of it. thus the resistance training.
How did resistance exercise help?
Well, like I said, the stronger you are going in, the stronger you are coming out. So I remember the first 6 weeks of radiation, they were tough, they were exhausting, tiring. Took the subway down to Princess Margaret every day. But I made a point not to miss a workout the same days. Yes, there were modified workouts, but you know what? At the end of the day, they gave me the energy to function, and it got me through the radiation. Surgery was next. A few bones were removed, and I was able to walk out of the post-op area within 24 hours. Again, the nursing staff there was fantastic, and they said, "Well, wow." I ended up staying in the hospital for 3-4 days. Doctors came back, couldn't believe that I was walking up and down the halls, stretching, lifting things. I knew I had to keep moving as best as I could in that situation. So instead of a 10+ day stay, I was there for 3 to 4 days, and I was sent home, told by the doctors to continue exercising. Went to the gym constantly, even though I had to do modified exercises. It was always resistance training and some cardio. And you know what, at the end of the day, it all worked. And here I am today.